Good evening. I want to welcome you and thank you all for joining us this evening. I'm Latoya Jackson, the Executive Director of the Harlem YMCA, and I'm thrilled to be here with all of you to talk about the COVID-19 vaccine. The Y is committed to doing everything in our power to support the city of New York, strengthen local communities, and serve those in need. This last year has been unbelievably difficult year for all of us and for all of our communities. And we know families in parts of Manhattan have been particularly affected by the pandemic. We are anxious for a return to normalcy. That will require protecting our communities and each other, and vaccination is one of the tools that will help us get there. The CDC recommends you get a COVID-19 vaccine as soon as you're eligible, but we know our community members want accurate information about the vaccines and may have questions for doctors. To empower our communities and support our vaccination education efforts, we're honored to partner with the New York-Presbyterian to host a series of webinars to discuss everything you need to know about the vaccine. For more resources, including eligibility and scheduling information, you can visit our website, ymcanyc.org/vaccines. Now, please let me introduce you to Dr. Erica Phillips. Dr. Phillips is a graduate of the University of Virginia. She received her medical degree from Columbia University's College of Physicians and Surgeons in 1998 and completed her internal medicine residency at the Hospital of the University of Pennsylvania in 2001. Dr. Phillips received a Masters of Science in Clinical Epidemiology and Health Services Research in 2003 from Weill Cornell. Thereafter, she joined the Division of General Internal Medicine, where she conducts research focused on health inequities in racial and ethnic minorities. An integral part of her practice is bridging her clinical practice in weight management with that of her research efforts in the behavioral management of obesity. Dr. Phillips was one of the founding physicians of the weight management practice at Weill Cornell Internal Medicine Associates. She's a diplomat of the American Board of Internal Medicine and the American Board of Obesity Medicine. Dr. Phillips, thank you so much for being here. I encourage people to use the Q&A function to submit questions that come up as you listen to Dr. Phillips' presentation. Dr. Phillips?
Thank you, Latoya. Good evening, everyone. And it is a pleasure to be here. It's a pleasure to be here with fellow Y families. I am a Brooklynite, a former member of the Bedford-Stuyvesant Y. Actually, when I first finished my residency training and returned to New York from Philadelphia, I had the pleasure of serving on the board of the Flatbush YMCA with the then executive director, Dorothy Jourdain, who has remained a faithful and growing member, or I should say leader within the YMCA family. My son in his school is a beneficiary of the after school programming by the Dodge YMCA. So I would say I've probably touched many different branches. And so it's a pleasure to be able to be here this evening to share with you information that we hope will be helpful to you in your decisions if it is that you have not been vaccinated yet. And so the part of this is also making sure that we're using the same language and we're all understanding of the same things. And so most important is recognizing that COVID-19 is the name of the illness that is caused by the SARS-CoV-2 or the novel coronavirus, which is the name of the virus that we've all come to know. Coronavirus is just, I like to say many of these viruses have many brothers and sisters because there are many different coronaviruses out there, the same way there are many different adenoviruses. And so understanding that the coronavirus that are typical sometimes household cleaners can kill is not always the same in terms of the brothers and sisters in the same family. We know that coronavirus is a respiratory illness in that it is transmitted not only by droplets, but by airborne transmission. And so very early on, we understood that droplet transmissions, which if you cough and sneeze, create these droplets that, if we recognize, are way smaller than a human ear, and thus they are pretty much invisible to all of us, and the reason why we do not know that they're there. But then as things progressed, we began to realize that that SARS-CoV-2 could also be transmitted in terms of airborne transmission, which are even smaller particles than droplet transmission, possibly produced just by talking and are suspended in air for a longer period of time and travel further, which was why early on in the pandemic, we began to see a progression from not just about being close to someone within 6 feet, but being also enclosed in areas such as dining, movie theaters, obviously facilities like the YMCA. Most recently, and I'm excited to see, is that we're finally beginning to see a bend in the curve in terms of the percentage of New York City residents who test positive over a 7-day average. Now, what's important to know about a 7-day average is that averages are just that. They take anywhere from 0% to extremes. On here, we see 8%, but we do still have some regions and neighborhoods of the city where the percentage of positivity rate is above 8%. But over the last 7 days, we're finally beginning to see really a downward trend, and we're almost getting ready to hit the line that we've set in the city that we want to be below, which is below 5%. The last time we were below 5% was almost last summer, and was a time that everyone was quite excited about. So why do we think we're getting there? Well, this is the reason we're getting there. So the good news is that there's a vaccine for COVID-19 currently available within the United States. There are 2 mRNA vaccines. Many people know this by the manufacturing companies, Pfizer being one of them and Moderna being the second. And then there's also a viral vector vaccine. And in a few minutes, I'll explain a little bit more the difference between mRNA and viral vector vaccines. The viral vector vaccine is made by Johnson & Johnson. All have been shown to be safe. All have been shown to be effective. But how we think about effectiveness, I think, is where a lot of people are a little bit sort of mixing up the numbers and what the earliest numbers in terms of that were shown in clinical trials really means. The mRNA, obviously, vaccines require 2 dosages in order to be fully vaccinated. However, again, and I'll show in a few minutes, there's great data now demonstrating that obviously after 1 vaccine, it's not as though 1 vaccine is not effective. It does reduce many of the outcomes that we are looking for, which is death, hospitalization, severe illness, and then documented infection. They do not contain the virus. So I know, similar to the flu vaccine, where everyone always says, oh, I got the flu after I got the flu vaccine. Well, no, you didn't get the flu after you get the flu vaccine from the flu vaccine. Same way you will not get coronavirus. You will not have a COVID-19 infection from getting the vaccine. But is it possible to still get COVID-19 after getting vaccinated? It is. Same way, it's still possible to get the flu after you've gotten the flu vaccine, because no vaccine is 100% going to prevent an illness. But again, in a few minutes, we're going to talk about what are the really important outcomes and why it is that we vaccinate in the first place. And so in spite of, even if you've had a COVID-19 infection, you still should get vaccinated. So more great news, 51% of eligible Manhattan residents have been vaccinated. So those of you on the line should be, if you've gotten vaccinated, great. And if you haven't yet, then I hope that there's something that I'll say this evening that will help you now make that number 52% by tomorrow morning. So currently a little over 5 million doses have been administered across the city in terms of New York City facilities, and a little over 2 million people have completely received both dosages. What we call fully being vaccinated is that 2 weeks after that last dose is considered to be full protection after you've received the vaccine. But before we talk about vaccines, we really first need to talk about, well, how does our immune system even work in the first place? Because you can't really understand how vaccines work if you don't even know how your current immune systems work. And so in our immune system, we have two major cells. We call them the B cells and the T cells. And there are at least two different B cells and two different T cells. And so helper T cells are those guys who are sort of standing on the corner and they see something's about to go down, but they're not trying to get involved. They're just simply there to let someone know, hey, somebody go call help. And so I call these, your hey yo B cells. That's what they're yelling. They're basically saying, I need someone else to come and actually take care of this thing that I see coming at us. So helper T cells are activated and they trigger our immune response, sending out messages to activate our B cells. Our B cells, and this is just, using the example of a B cell taking out the flu virus, but as you can imagine, this flu virus could be a coronavirus, it could be adenovirus, it could be any of the many different various viruses that exist. And what our B cells begin to do is they begin to create antibodies. And that is this Y-shaped particle that's here. And that Y-shaped particle basically is trying to attack this viral cell. And it does so by recognizing this Y shape, while it doesn't look like it's a perfect match, has basically modeled itself to recognize and to connect to what's on the surface of this virus, which is a spike protein. In a few minutes, when I show another picture, it will become even more clear. So once we've created these antibodies the first time around, we want to make sure we continue to have that memory. And that's the whole purpose of antibodies when our body creates them. It's to be able to, the second time around, or the third time around, or the fourth time around, that a particular virus or infection tries to, again, attack us, we now no longer have to wait for our T cells to go find our B cells, because our B cells are like, no, I've seen you before and I remember you. And so what we end up doing is creating memory B cells. And this is the exact purpose of a memory B cell, to say, hey, I remember you and it's time for you to get out of here. But also in this process, we have, while we have these memory B cells and they remember you, we have what we call killer T cells. And it's our killer T cells that really attack a cell once the virus has infested it. And so this is the viral antigen on the surface of this cell. This is a target cell. You can imagine any cell in your body that's been infected with virus. So the virus is not only attached, but found its way in. A killer T cell comes along, connects to the same spike protein or the same antigen or virus in this case. And by doing so, it's now attached and begins to inject into our natural cell, sort of, I guess you can consider this bullets, starts to basically shoot bullets into the cell in order to attack the virus. Well, as you can imagine, while you're attacking the virus, you're also unfortunately attacking the host cell. And for those who have either unfortunately had a COVID-19 infection or know someone who's had a COVID-19 infection, you may have heard of many of the various other things that happen from having a COVID-19 infection that are not actually directly related to the virus, but actually represent our body's inflammation response, as well as the destruction that occurs when not only we attack the virus, but we also attack the cells that it's living in. So now we can talk a little bit about, well, then what exactly is a vaccine doing, and how is it helping our body make antibodies? So the main approach to making a vaccine, whether it's COVID-19 or not, the approach to making all vaccines is that there are three different ways that you basically can trigger that immune response. That there's three different ways that you can help your body make memory B cells in order to remember and be able to make its own antibodies against a particular virus. So the one way is that you can use the whole virus as a way of triggering the immune response. You can use parts of the virus. So in this case, just the spike protein. And this is one way. And then the last is that you can just use the genetic material. So again, the virus has three main components. We have this exterior shell, we have the whole virus, or we just have the RNA material. And the RNA material is basically a signal. It's a code. It's like a recipe book. It's a recipe book that says, that gives you the inside code to what it is that the virus actually looks like. And so in the case of the Pfizer and Moderna vaccines, they are using the genetic material of the virus, the mRNA, in order to create the vaccine. Here, I just wanted to share a couple of examples of vaccines that you're readily familiar with in terms of to show you that obviously various vaccines are made different ways. So for example, the hepatitis B and pertussis vaccines are made by using these proteins on the external surface only and does not use any of the genetic material or the whole capsule of the virus. And then here, a viral vector, this is an example of the Johnson & Johnson vaccine. For those of you who may have remembered the Ebola outbreak some time ago, Ebola also used a viral vector. And what a viral vector is that it takes the entire virus, in this case, the coronavirus, takes that virus and injects it into another virus. So the Johnson & Johnson vaccine takes the whole coronavirus, and it's not a live virus, injects it into adenovirus, which is the common virus that causes the common cold. And then what you're receiving is the ability of the adenovirus to protect the coronavirus long enough that it makes it into your cells and long enough for your body to begin to create antibodies against it. The flu vaccine is also an example of a whole virus or whole bacterium-like vaccine. So if anything, these are very similar in terms of their format. And it's why sometimes what you've heard is people say, well, I want Johnson & Johnson because we've been making vaccines that way for a very long time. And I don't know about mRNA. However, that's actually inaccurate in that the science between the mRNA vaccine has been around for more than 30 years. And actually, it's been studied and attempted in terms of other infections in the past, such as cytomegalovirus, which is a type of virus that can infect the liver. And it's actually mRNA as a medium has been used in many actual cancer trials in terms of creating medications that would treat cancer cells. And so this concept of the use of mRNA as the trigger response is not a new concept. So just a little bit more about mRNA as a recipe code, because that is the one that people are spending a lot of time talking about because they've been unfamiliar with it. And so when we think about the vaccination, again, it's taking the mRNA or synthetic RNA and injecting it into our cell. What it is not doing is at no point in time does the mRNA get into our DNA, which is protected in this inner nucleus. And in fact, actually, the RNA doesn't stay around for more than a few days because our body breaks down and gets rid of everything. It stays around long enough for our body's immune response, as I showed before, the memory cells to be created, and for us to begin to make our own antibodies that recognize the spike protein of the coronavirus. So if you think about RNA as a recipe, for many of you who have had, family recipes that are passed down from generation to generation, it was probably the hardest thing to get your grandmother to tell you the secret ingredients of her recipe. But once she's given you the recipe, well, why does she not want to give you the recipe? Because once she's given it to you, you learn how to do it, and you do it over and over and over and over again until you finally get the pie mastered. And then you no longer need that recipe book. And so the same thing is going on here, which is that the RNA, you no longer need it. And it's actually eradicated out of our cells. It stays around long enough in order for us to make our memory B cells. So now that we've talked about vaccines and the difference between them and how they were made, why should we consider getting vaccinated? And the main reason is to protect ourselves, not only from COVID-19 as an immediate infection, but what we're beginning to learn more and more about is the long-term sequela of severe illness from COVID-19. Obviously, not everyone who incurs a COVID-19 infection dies from it. Not everyone who incurs a COVID-19 infection gets hospitalized or has severe illness. And there are millions of Americans who've had a COVID-19 infection and didn't even realize that they had it because they had no symptoms. However, for those who are unfortunate and do incur a severe illness, what we are finding is that obviously at the time of illness and long-term, that there's potentially structural changes that can occur to the heart. We can find enlargement of the heart, which then can go on to cause heart failure. We've seen long-term sequelae of worsening kidney function. We definitely, during the time of active infection, have seen increased blood clots. These increased blood clots have led to things like pulmonary emboli, which is a fancy term for simply saying blockages that occur in the arteries of the lungs, which then cause more difficulty in breathing and can actually be very lethal because they can cause death. We see brain fog, which is a phenomena where people, whether it be from the time that they spent on a ventilator, or they're actually being inflammation, as I showed earlier, the killer T cells, the inflammation response that goes off in our body seems to be causing potentially longer term issues to nerves, whether it be weakness, paralysis, tingling sensations, sort of a pinning, prickling, or tingling in our nerves. And then obviously the most common thing that people are familiar with is obviously the coronavirus causing lung infections and pneumonia, which is one of the reasons why one of the most common symptoms of coronavirus when it affected individuals is pneumonia. The problem with some of these pneumonias and severities of these pneumonias is that they can cause long-term scarring of the lungs, which then create long-term shortness of breath on exertion and making it far more difficult for people to naturally do the things that they used to do. So we really want to think about getting vaccinated in order to prevent some of these sequelae, because the one thing that we don't know is who's going to have a severe illness and who's not going to have a severe illness. The other reason to consider being vaccinated really is also about protecting your family and your community. As a healthcare provider, I can say that every year I get the flu shot. Am I truthfully worried personally about getting the flu? In all honesty, no. I get the flu shot to protect myself from being a transmitter of the flu to vulnerable individuals like my patients. And that's actually why I get the flu shot every year. No different than my reason why I've already been vaccinated for coronavirus, to protect my family, especially working through the pandemic. One of my greatest fears was coming home from work and transmitting coronavirus to my family members. And now, while I still obviously continue to do the mainstay of preventing myself from protecting myself, which is wearing a mask and washing my hands, I do have a greater sign of relief of knowing that I'm potentially not the person who's transmitting this virus to my family. So a vaccine not only protects an individual, more importantly, a vaccine really protects our community overall, in particular our Y family. I think Ms. Jackson said it best. We were joking earlier before everyone got on, when she says that she runs into her members and they say that they're so ready to come back. And she's like, well, have you been vaccinated yet? And well, then she's like, if your answer is no, then that means you're truly not ready to be back with your Y family. And I would have to agree. Why else should we be vaccinated? Really to end the pandemic. It is without any doubt whatsoever that vaccines are life-saving and they end pandemics. We've seen this time and time again. History has taught it to us. And so if you're not a lover of history, there's not a history book that won't show you that vaccines have ended pandemics. In 2019, we had no cases of smallpox reported in the United States. In 2019, we only had 2 cases of diphtheria. We've obviously had outbreaks of measles, but yet we are still by no means near the number of measles outbreaks that we would have had in the 20th century. Yes, we still have cases of mumps and pertussis, but yes, we still are nowhere near where we would have been. We've had 0 cases of polio, we've only had 3 cases of rubella, and we've only had 14 cases of H flu. And as you can see, what a vaccine has done is has reduced the rates of these conditions anywhere from 92 to 100%. So how do we know that vaccines work and they're safe? Well, one, history has shown us this. They've shown us that these vaccines that have been produced, and all of the vaccines that I just showed you on that slide, none of them are exactly the same. So again, this goes back to the fact that vaccines have always been and will continue to always be made differently based on the virus or the infection that they're targeting in the first place. Each vaccine that's on the market And I would say that at this point, this slide is outdated because this is referring to the clinical trials, where in the clinical trials, they were tested in thousands of people. We now have data, and I will share this in a few minutes, in particular, looking at certain countries like Israel, where they have shown effectiveness in well over 600,000 people who were vaccinated in comparison to 600,000 people who weren't vaccinated. And so we now have real world experience now being in April regarding how the vaccine is actually working. So again, all the vaccines are very safe in clinical trials. They prevented COVID-19 illness. The Pfizer and Moderna vaccine are 2 doses. People have had mild to moderate side effects. There is not a vaccine out there on the market where people have never had side effects. Every vaccine, there is a side effect. It can be local, and it can be far greater than that in terms of it can be systemic. Again, in the clinical trials, the Moderna trial, there were over 30,000 US adults. In the Pfizer trial, there were over 44,000 in the US and other countries. We had across all of the trials, individuals who were over the age of 65 and individuals who are various races and ethnicity, and most importantly, as we've seen in the most recent week, in terms of now being able to loosen the stringency of vaccination here in New York. All 3 vaccines were approved for at least those 18 and older, and Pfizer went down to 16 and older. And currently there are ongoing trials, which we hope the results of which are looking extremely promising in young children, and hopefully we'll see a vaccine for those under the age of 16 released before the end of the year. Often people ask, how was the vaccine created so quickly? I don't trust it because it came out too quickly. And really this comes down to a demonstration of what our country and what the world can do when we are all of one accord. And that's the reason why the vaccine was able to be released so quickly. It wasn't because there were any steps that were skipped. It was because everyone, CDC, FDA, president, prime ministers of every country, whoever you could name was on board in terms of we have to get this done, not as a country, but as a world. Clinical trial phases were overlapped. One of the longest phases for some of these for vaccination creation actually is partly in manufacturing it in the first place. It could take on average 18 to 24 months for manufacturing. One of the major things that was done was that manufacturing overlapped with the creation of the phases. So from as soon as the scientists started to create the vaccine and test it, they were working on, well, how do we get it out the door? Rather than waiting to get to the end of phase 3 to start thinking about how to get it out the door. Manufacturing, as I said, began while clinical trials were still under the way. So therefore you cut out almost 2 years of the process. The FDA and the CDC were prioritizing review, so it didn't have to sit on anyone's desk for several months to be read, and authorization occurred at that time. And thousands of people stepped up in order to volunteer. The other important thing about why things rolled out so quickly was because there were people who really wanted to see this vaccine ensure that it was going to be a vaccine that we could say services all people and that everyone was involved in the clinical trials. I had 2 colleagues, while Cornell Medical Center at NewYork-Presbyterian was one of the trial sites led by Dr. Kristen Marks, who's one of our infectious disease doctors. Many of the physicians in my hospital stepped up to actually participate in the trial because we recognized how important this information was. And so when everyone works together, that's why we were able to roll out these vaccines as rapidly as we were. And it wasn't because there were any safety measures or safety phases that were skipped. And so obviously, as we allow coronavirus to continue to jump from person to person, it allows the virus to mutate. And so what we've seen over the last several months are 3 variants. a variant in the United Kingdom called the B17, a variant in South Africa called the B1351, and a variant in Brazil, Japan called the BP1. And what differs between all of them is that spike protein that everyone talks about. And so we've just sort of color coded it here to represent the difference in the spike proteins. However, the innate sort of signals that are in the virus itself and the sort of the contour of the virus remains the same. So in any epidemic, and this goes for even, as we all know, the flu, every year our scientists try to predict what the flu virus is going to look like. And it's the reason why every year the flu vaccine is different. If epidemics continue, viruses continue to spread, and the longer we allow a virus to spread, the greater it begins to mutate. Vaccinations are our best tool to stopping mutations. When a virus is unable to jump from person to person because it no longer has a host that can host it, it doesn't have the ability to mutate. Thus, another reason why it's so important to get vaccinated if you're able to get vaccinated so that you can contribute to stopping the mutation of the virus. Vaccines will help protect us against new strains, but may not be as effective. But vaccines are still our best way of slowing the virus and stopping mutations. So what else should you know about protection? Some of the questions that we've gotten over the last several months is, I've already been infected with COVID-19 and I have COVID-19 antibodies. Should I still get the vaccine? And the reason is yes, because some people have become reinfected and the vaccines might provide better protection than our actual initial immune response. The other thing is that we're still unclear about how long our own antibodies last, and that's also true for the vaccine. We're still measuring and monitoring how long the antibodies to the vaccine actually last. And so by getting vaccinated, one of the things that you may be doing is sort of boosting your own natural immunity system. If I get vaccinated, do I still need to wear a mask and practice social distancing? And my best answer to that is until we hear the CDC say it's okay to take those things off, or our local, excuse me, state governments have said that, until that time, we know that it's still important to wear our mask and to practice all of the hallmark things that we've been doing all this time. And again, how long protection will last is still, excuse me, from the vaccine is still a question. And so I'll end with, we still want to practice our core 4 functions in order to stop the spread, which is wearing masks, maintaining a social distance, washing our hands with soap and water for at least 20 seconds. And if we feel symptomatic or unclear of our symptoms, to stay home if we're sick, to get tested, and lastly, most importantly, to get vaccinated if you are able to. And so I'll stop there so that we can take questions, because I think questions are probably the thing that everyone is always the best part of it.
Thank you, Dr. Phillips. One question that I have here. How effective are the vaccines on those new variants that are popping up these days?
Right. So that's a great question. And I think the best answer to that is that we, especially when you sort of look to places like Britain, and that's probably the best example, in that there obviously is a British variant. And in fact, Britain has taken a model different from the United States in that they are currently going with the method of getting at least 1 shot in the greatest proportion of the population. And if you recall what I just shared, the most important thing about mutations is about stopping the spread. The less people you have infected, the less hosts that you have available, then that's what stops the mutation. Because if a virus can't jump from person to person, it can't mutate. If you look at the current British data, they have had the sharpest decline, even in comparison to the United States, of actual infection rates and spread of the disease. And so, in fact, a lot of the recent data coming out obviously shows that after just 1 dose, you do have some protection. It is not as high as the 2nd dose in terms of the booster, but both after first doses of Moderna or Pfizer, or if you just get Johnson & Johnson, it has clearly showed in Britain that just 1 shot has been effective in decreasing the spread. And given that that's where one of the mutations started, I think that's the best evidence to show that the vaccine still is working against mutations. Because the most important thing about stopping a mutation is actually stopping the virus from jumping from host to host.
Got it. Um, what if I have allergies, and what happens if I have an allergic reaction to the shot?
Great question. First and foremost, I'm always going to defer that please talk with your primary care doctor or your doctors about the nature of your allergy. Um, there are people who obviously have many allergies to antibiotics, who have had severe allergies in response to other vaccines. And it's difficult to answer any allergy question without knowing the person's actual allergies directly. And so the ingredients that are in each vaccine are well known, and our providers can obviously look at the ingredients of that vaccine and compare it to the ingredients of another vaccine if someone has had an allergic reaction to another vaccine or to a particular medication that might have similar ingredients.
Got it.
The most important thing I'll say is that if someone does get vaccinated, obviously every vaccine site is responsible for watching and observing for at least 15 minutes. The reason that 15 minutes is actually set is that what we know from the data and overall just from vaccines, if someone is going to have a true severe allergic reaction, the most severe of allergic reactions is what we call anaphylaxis, which is true death from an allergic reaction. It is going to happen in under 15 minutes. And so that's why the 15-minute mark was set, because if someone's truly going to have an allergic reaction, it's going to happen within those 15 minutes. It's not going to be an hour from now or 2 hours from now. A true severe reaction will happen in that time frame.
Got it. So there are two shots, Johnson and Pfizer has two shots, Moderna has two shots, Johnson & Johnson has one shot. Are any of them more effective than each other, or they just basically provide the same protection?
So the best vaccine is the one that you get, in the sense of you're better as a vaccinated person than an unvaccinated person. And I actually have a slide that I want to use to show this. Let me just see if I can find it real quickly again. As things continue to evolve, we are gaining more and more data. And most recently in Israel, and while it happens to be in Israel, it's because many countries, unlike the US, because they have universal health care, the countries have a far greater ability to pool large data. And so what we know about any study, when it's done in a clinical trial, is sort of what in medical care we call the gold standard. It is the best way to know, does something work against something else? But the fact of a clinical trial, it's not the real world. And what we're now beginning to have is real world data. And so this study actually was just released about 4-6 weeks ago. And it was one of the currently largest studies where in each group, it looked at close to 600,000 people. So there were 600,000 people between December and February in Israel who were vaccinated with the Pfizer vaccine versus not vaccinated. And it looked in particular about 14 to 21 days after the first dose. So going back to, I think, what I shared earlier, what are the goals of vaccine? The first and foremost goal of the vaccine is to prevent death or to reduce it. The second is to reduce severe illness. The third is to reduce hospitalizations, then to reduce symptomatic COVID infections, and then obviously to reduce the documented infection, because if you don't get infected, period, then you can never transmit it. And so what we see with at least Pfizer is that even after one dose, we have reduction in infections, we have reduction in symptomatic COVID illness, we have reductions in hospitalizations, we have reductions in severe illness. And after the second dose, we see that number go up extremely high. Now, this is 7 days after the second dose. 92% of individuals, or the 92% reduction in severe illness, an 87% reduction in hospitalizations, 94% effective in preventing symptomatic COVID, and 92% in terms of not having a documented infection at all. So in other words, you came in, you were exposed, and you did not get infected. What we know is that if you compare those who were vaccinated, there were 9 deaths. Compared to those who were not vaccinated, there were 32 deaths. So the take home is vaccines save lives. That is Pfizer. Pfizer has done, I cannot say, I'm not going to say that Pfizer is necessarily more effective than Moderna or more effective than Johnson & Johnson. All I can say is that there is much larger data in terms of numbers right now as it relates to Pfizer, as it relates to this study in terms of real world data. So overall, yes, right now, as it relates to data being available, that is very highly effective data as it relates to Pfizer.
Got it. So is it safe to say that if you are vaccinated that you cannot transmit the virus?
Well, remember what I showed you was 92%, there was still 8%. So there is no vaccine that's ever going to be 100%. So you cannot say, it's safe to say that just because you got the vaccine, you can't transmit the virus. We can say that getting vaccinated helps to reduce, right, at this point, your chances of transmitting the virus. And definitely what we see in Britain, by giving everyone, as many people as you can, we're currently 50%, half of the UK, half of individuals, residents in the UK have been vaccinated, that it has made a significant difference in reducing their numbers quickly, and thus will help to reduce mutation.
Okay, I think that's all the questions we have. Is there any one last, you had to leave our audience with one last sentence, what would it be?
So the last sentence would be is that I know that that many people are worried about the long-term side effects of the vaccines because we don't know. I see it as you can look at a glass half empty or you can look at it half full. While we may not know, in all honesty, the long-term effects of the vaccine, what we do know is the long-term effects of COVID-19. And so if I had to weigh what I know compared to what I don't know, I would always weigh on the side of caution in terms of protecting myself against what I do know. And what I do know is that COVID-19 kills. What I do know is that COVID-19 has long-term sequelae. Yes, I don't know what the long-term effects of the vaccine are, but I rather go with what I do know, which is that vaccines, the vaccination is going to help to reduce chance of death, hospitalization, severe illness, and the long-term consequences of the infection.
Got it. Well, thank you, Dr. Phillips, for all the information you shared this evening. I want to thank everyone who joined us for your interest in the vaccines. Vaccination is an important tool in making ourselves, our families, and our communities safer. For resources on eligibility and scheduling a vaccination appointment, you can visit our website at ymcanyc.org/vaccines. And for more information about the vaccines, you can also visit NewYork-Presbyterian's COVID-19 Vaccine Education Center at www.nyp.org/COVID vaccine. Thank you, Dr. Phillips.
Thank you, everyone. Have a good night.